are a recovery room nurse at a general hospital. You receive an 8-year-old female who has just undergone a successful tonsillectomy. During the surgery, the child had ventricular fibrillation with a successful conversion to sinus rhythm. She was intubated and remains intubated upon arrival in the recovery room. The child has not awakened yet. She has waveform capnography in place. 1. Proper ventilation and oxygenation are achieved at an oxygen saturation of A. 94 to 99%, B. 96 to 100%, C. 98 to 100%, D. 100%. Correct answer A. 94 to 99%. The goal for oxygen saturation following ROSC is at least 94% to prevent hypoxemia, but less than 100% to avoid hyperoxia. 2. Which of the following monitored parameters ensures adequate ventilation? A. Hyperventilate the patient to prevent an increase in intracranial pressure. B. Measure oxyhemoglobin saturation by pulse oximetry rather than arterial blood sampling. C. Maintain partial pressure of CO2 at 35 to 40 millimeters of mercury. D. All of the above. Correct answer C. Maintain ventilations to achieve a normal PaCO2 of between 35 and 45 millimeters of mercury. It is reasonable for practitioners to target a PaCO2 after ROSC that best treats the specific patient condition and adjust ventilation to prevent severe hypercapnia or hypocapnia. The team measures the child's partial pressure of CO2 via capnography at 38 millimeters of mercury. 3. The correct intervention at this time is to A. Maintain current ventilations. This is normal and desired. B. Increase ventilation rate. C. Decrease ventilation rate. D. Reposition the endotracheal tube to ensure better oxygenation. Correct answer A. Maintain current ventilations. An exhaled CO2 of 38 is within the desired range of normal, so the team should maintain current ventilations. 4. True or false? The team should actively work to prevent fever in comatose patients. Correct answer, true. Observational studies have reported that a patient who had just achieved ROSC with fever is associated with poor outcome. 5. True or false? For pediatric patients between 24 hours and 18 years of age who remain comatose after cardiac arrest, the team can either use targeted temperature management, 32 degrees Celsius to 34 degrees Celsius, followed by targeted temperature management, 36 degrees Celsius to 37.5 degrees Celsius, or use targeted temperature management in a range of 36 degrees Celsius to 37.5 degrees Celsius. Correct answer, true. Induced hypothermia is now called targeted temperature management. Targeted temperature management for comatose patients aims to preserve the brain and heart from further damage by reducing the metabolic demands of these vital organs. 6. True or false? It is reasonable to delay the correction of hypotension following successful resuscitation. Correct answer, false. Avoid hypotension and immediately correct it during post-resuscitation.